Okay, thank you for that one. Okay. Moving back to the paper speakers for the proposition, we now have Professor Jonathan Heaney. Professor Jonathan Heaney is a vaccinologist and infectious disease scholar and is a professor of comparative pathology. He is a fellow of Darwin College and was formerly co-vice master of the college as well. You have the ears of the House.
Thank you, Mr. President. Thank you very much for the solid points made by my esteemed colleague. The opposition to making vaccines mandatory include those who feel free, and I'm talking about the refuseniks, not the hesitants so much, freedom of choice, freedom of movement, and freedom of travel. In the case of infectious diseases, vaccines play a critical role in protecting our civil liberties. Vaccines prevent widespread outbreaks, infectious diseases. They help ensure that we can live our lives with fewer restrictions. Key, freedom of movement and travel. Important, the limitation of infections to others. The spread of contagious disease is minimalized. Citing the need for travel bans, who wants those? Quarantines or lockdowns? Those are infringements in our civil liberties. Economic stability, by keeping people healthy and reducing the burden of healthcare systems, vaccines support economic activities and job security. Education and work. Vaccinations help keep schools and workplaces open, allowing individuals to pursue education and careers without interruption. Key for institutions such as ours. Public health and herd immunity. Herd immunity, as we've heard, is a ubiquitous number. Depends on the infection that we're talking about and the type of spread. Somewhere around 90%, some say. Protects the vulnerable populations who cannot be vaccinated, ensuring that everyone's right to a safe and healthy environment. In essence, vaccines support the fundamental right to health, movement, and participation in our free society. So when individuals in society refuse to be vaccinated, they not only endanger their own health, but they can transmit and do harm to those innocents amongst us, affecting the ability of the healthcare professionals to do their daily job, to attend to those who are in need of health care, is a violation of their right to health. Paradoxically, those who refuse vaccines endanger those very freedoms they fight for. Every person who is not vaccinated or is partially vaccinated gives the virus another chance, another opportunity to replicate. And in my world, replication means mutations, and mutations give rise to variants. And we know, déjà vu, COVID, they can escape. And when these variants escape vaccines, another lockdown looms. So when vaccine escape variants prevail, the threat of another lockdown and the loss of our liberties. And that is because those minorities felt that it was their right not to take vaccine. Notably, vaccine can prevent pandemics, and new pandemics are looming. If broadly protective vaccines are available early enough to contain and control an epidemic, we can control, eliminate it, and eradicate it. That, hopefully, is the new future. But we need public participation and access to vaccines. Everything must be done to make sure there is freedom to access and better public education. That is an essential criteria for success. Evidence that vaccines work in eliminating pandemics, as we've heard, smallpox. The disease that was eradicated in 1980. Last vaccine was given in 1972, I believe. But there are high-consequence human infections like Ebola, monkeypox, that are not yet eradicated and that loom and that we need to consider for the future. And I'm talking not about the next pandemic, but possible epidemics, and epidemics that are regional and then crop up in sub-Saharan Africa and decimate communities yearly. Vaccines are our best medical intervention. We've heard that they're next to water, safe, and have saved more lives, and that's 6 lives every minute. Immunization and vaccination is the single greatest contribution to any health intervention, ensuring babies not only see their first birthdays, but continue leading healthy lives into adulthood. Vaccines are the best way to ensure our freedom from disease and our freedoms. The facts are clear. A child born today has 40% increase in survival each year of infancy and childhood, and survival benefits from infant vaccination extend beyond 50 years of age. Even if you exclude smallpox, HPV, and influenza. Furthermore, considering the added benefit to reduced morbidity and recent data that estimates over 10.2 estimating over 10.2 healthy years of life gained because of the use of vaccines. Vaccines for infection cancers are particularly relevant these days, demonstrating staggering results. And I'm talking about the human papillomavirus vaccine. And they prevented precancerous conditions, saving an estimated 600,000 future deaths of women from cervical cancer. These are advances from our new vaccine technologies. Other challenges remain, but successful vaccine programs are impacted by disinformation, often religious beliefs or vaccine hesitancy, and, of course, access. Look at polio, measles, Haemophilus influenza B. Each of these debilitating, life-threatening diseases could be eradicated, but they're not. We have yet to achieve that magic number to achieve eradication of measles. In my profession, a similar related disease caused rinderpest in cattle, but it's been successfully eradicated from this world, necessitating no vaccines. So, when false rumors or statements were made, we know about the autism claims of the MMR vaccine, measles, mumps, rubella. Vaccine hesitancy fueled an increase of measles cases. And they persist. This eradicable disease exists because of our, let me finish, please, exists because of our inability to immunize sufficient numbers of individuals.
A point of information about autism and vaccines. Dr. Wakefield, are you aware of his work?
Yes, it's absolutely malarkey.
How is it?
Yes.
How come he's still prevalent in the world of science, in the world of remedies?
It has no correlation with vaccination, and there's significant data. I'd like to move on, please. That is completely scientifically unfounded, and it's fiction. Sorry, no room for non-science here.
Guys, please keep some order in the chamber. Continue with your speech, please.
Infectious diseases such as these could be better controlled and eradicated and continue to affect individuals as well as the public. And the social well-being and the loss of productivity of families is due to the failure to ensure these vaccinations. In conclusion, again, as stated by my honorable colleague, next to clean drinking water, vaccines are by far the most important and cost-effective public health care measure. In contrast to social media rumors, vaccines are safe and healthcare benefits outweigh the adverse events. Next-generation vaccines have the potential to control and contain disease outbreaks, but only if there's full participation from the populations, or we'll experience the same scenarios of variants and new waves of lockdowns as we experienced with the COVID pandemic.
You've mentioned that there's a growing hesitancy towards vaccinations, and there are no doubts that vaccinations have positive health benefits. However, making vaccinations mandatory might even increase this hesitancy and fear of it, and potentially...
Thank you. As we've heard before, I agree. there must be full implementation of other methods first before we resort to draconian mandatory vaccination. That is what this is about. How do we achieve that vaccine mandate without draconian laws from the Middle Ages? We can achieve that through other matters or measures that have been mentioned by my honourable opponent. In the vacuum of information in public education and dialogue, mistrust increases vaccine uptake, and that's why education is essential. I'd like to stop there.